My name is Krzysztof Narkiewicz. I'm together with Diana Ferrao, the representative of the Young Investigator group, also the council member of the society. Welcome, Diana.
Thank you so much for having us.
We'll try to summarize Friday, the second day of the ESH Congress in Gdańsk. Very busy program, a lot of activities. So let's start with the morning session. Hyper hope for the future, for the novel technologies. What is your take from this exciting sessions? Because we had three presentations, slightly from different fields, but I think it was exciting. So tell us what do you take as the main message from this session and the lectures?
It was very exciting, actually. You are totally right. I think we were able to join three very different aspects of what the future might look like in our pretension regarding technology. We discussed, first of all, the role of artificial intelligence. And I think Professor Brian Williams had a lot of very interesting insights to share that were very new and outside what is usually said about artificial intelligence. Afterwards, we discussed social media, which, as you know, is is something that I'm currently a little learning about a lot, because I have been a part of the communications task force of the society, and we do need to assume a role as a society and as individual physicians and researchers in leading the conversation in social media, because nowadays social media is progressively contributing to misinformation, and we need to be engaged in the conversation to be able to pass along more information to our patients and to our community. So it was really a very interesting session.
Okay, so what about the other sessions that today you found particularly interesting? So which one? I was very impressed by the keynote speakers because this was also, I think, a kind of highlight of today. So we had three brilliant lectures. So which one for you was really the most thought-provocative and interesting?
I have to admit, I have a soft spot.
Okay, tell me.
For Professor Lotte Bjertsen, because she is. I'm an internist, and GLP-1 agonists have been life-changing in our daily practice. We have a lot of patients with obesity that we couldn't tackle and that we couldn't solve. And from a few years from, like maybe 2-3 years from now, we will be able to actually solve that problem. And it's really been life-changing. And listening to her was absolutely inspiring. So it was amazing to have her here.
GLP innovation story
Yes.
was the title.
Yes.
So indeed, I think she, and of course the team, she tried to explain it's not only alone, and of course I think many years of discovery science, and I think this is the reason we also in Gdańsk have a basic research track, because sometimes we as the clinicians forget that we need basic science, translational medicine, many disappointments on the way, many different targets to get at this moment that, as you said, the GLP-1 agonists would come to clinical practice. I was very impressed by a presentation of the Swiss group. This Swiss group from Lausanne, Jacqueline Bloch and Grégoire Courtin. Let's say not from hypertension community, not from cardiovascular community. So they introduced a new method of neurostimulation, neuroprosthetic innovation, bringing a hope to the people with tetraplegia after accidents or neurodegeneration, like Parkinson disease. So the story they showed, but also years of different experiments, basic science, cell biology, and then experiments in humans, showing that indeed those people experience sometimes, a tragedy, skiing somewhere, and your life is completely reversed. So there's a hope for those people, and they also struggle with blood pressure instability. So of course, this would affect also the quality of life. So I was really impressed that something new coming to the cardiovascular field also for this particular group of patients. So with also for the very first time in Gdańsk hotline session. So we will present altogether 8 clinical trials in Gdańsk, and today we had 4 trials presented. So Diana, which one you would like to discuss and present?
Again, I have a soft spot.
Of course, tell me.
My PhD project is about aldosterone, so I have
Okay.
a soft spot for aldosterone synthesis inhibitors, and to listen to the history of the BAX HTN and the BAX 24. It was
New data.
yeah, these new data that was presented, and it's also very. It was very good to have. Such interesting clinical trials, some of which we already read about, some we didn't, but to have someone discuss them at the end and to have incisive commentaries, it was very, very interesting. So it's very good for us young people to not only see, because sometimes we incur in the error of just believing everything we read and being excited by everything we read. It's very interesting to have the other side, the side of you didn't do that very well and that's missing something. It's very, very exciting for us as well. So
yeah,
it was
I
a
think
great session.
it's a great story. So maybe I would mention a Polish trial, Optimal
Yes.
HD trial, showing that if you take into consideration white coat hypertension, if you base your decisions on out of the office measurements, but both home blood pressure and ambulatory blood pressure, and you take into account adherence, and if you switch the current treatment to a triple single pill combination, you could achieve blood pressure control in 60-70% of the patients. So we had a discussion. Can you call them uncontrolled if actually with one pill you can control? But I think it's a really very important trial because I think the strength of this study was that the aim was to get the blood pressure control below the current targets, so below 130, and as many of the previous trials, it was below 140. Yeah. So I think this is a kind of first trial trying to address. Of course, we had a presentation related to aprocitentan, so acting at endothelin, I think pathway, it was very important. I think we had also a presentation with renal denervation,
yes.
The effect
anxiety.
on anxiety. So plenty of I think exciting results and a vibe discussion, poster session now ongoing even for the oral presentations. I think the rooms in many cases were full.
Definitely.
So I think this is it for the second day. I think the good news is that also we recorded several sessions. So for the main halls, which will be available on the website of the society. In addition to the presentations of the working groups, other activities, we would really like to encourage you to join, first of all, the society. I think it's a very vibrant society. I think the social media of the society, I think is the best way to keep the track of what's going on. And we hope to see many of you tomorrow on Saturday, another exciting day. And I think future meetings of our society, including Basel in 2017 and Glasgow in 2028. So many meetings to come.
Yeah, and I have to use this opportunity to thank the society and you, Professor Krzysztof Narkiewicz, for having us young people and for really exciting us to join. And this is really a big family, not only the ESH, but young investigator community. So please join us and you will be excited too.